really we were able to still meet the needs of our patients in the face of the pandemic.
As all these measures were put in place to prevent or protect pharmacy workers from getting infected.
Medical team actually could identify them early, to triage them to a different, either the high dependency wards or the ICU isolation.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
COVID-19 has impacted many countries around the world. In this episode, we will hear from pharmacists from North America, South America, Europe, Africa, and Asia. They will provide insights and facts about the pandemic in their respective countries. We will also hear about how pharmacy practice has been affected during the pandemic. We hope the following information will help you understand COVID-19 on a global level, understanding the challenges each country faced and the outcomes of their response.
Well, I mean, overall, I think we've seen a significant slowdown in Canada. As we've tried to brace ourselves through the pandemic. I think different provinces and jurisdictions have been affected differently. Fortunately, for now, it seems like cases are dropping across the country, and things are starting to slowly open up. But we know that there's other areas, particularly our neighbors to the south, which are still struggling, which doesn't really bode well for us. I think we're entering a period of still ongoing periods of being unknown what's going to happen next, and I think we're going to have to brace ourselves for sort of a longer period of social distancing until we can figure out what sort of testing may become available, or different testing strategies that can be put into place to make sure that we can trace and isolate cases, so that we don't see another uptick like they're seeing down in the southern states especially. I think all pharmacies responded in their own unique ways. We saw a lot of movement very early on. We know as providers of an essential service that it was important that we did remain open and operational in some way. In our pharmacy in particular, we right around the mid-March is when the state of emergency was declared. We went to curbside pickup and delivery only, so we closed our doors to the public in order to maintain a safe environment and make sure that people could properly distance themselves. We did that for more or less 2 months, if not 2.5. We opened up just earlier this month in June, letting people back into our pharmacy, but we're still operating with a curbside pickup model, as well as expanded delivery service. I think many pharmacies have seen that the amount of deliveries that they were doing is probably doubled, tripled, or more. So those are just some of the ways. I think we've also seen a lot of, obviously, rather than face-to-face dialogue, a lot of strain on the phone systems and things like that. Reducing hours was something that we've done, and I think we've seen that across a number of pharmacies as well. But still managing a full workload as it relates to especially supporting patients with chronic medications.
So I'll really speak with the hospital pharmacist lens, because that is sort of my area of expertise. And so here in Canada, of course, we've been managing relatively well with the pandemic as compared to other countries in terms of our federal response to the pandemic. Our numbers are going down every day, although, of course, as with everything, we're anticipating a second wave starting likelihood this fall. So for hospital pharmacists, what really was the key kind of issue facing hospital pharmacists with this pandemic was the drug supply. And so medications for critical care, medications to treat patients with COVID were certainly at the forefront, and whether we would have enough supply to last for the entirety of the pandemic and for potential surges as we've seen in other countries was really at the forefront of our response. And so I would say that we were very fortunate in Canada because they implemented sort of the lockdown fairly early on. We did flatten the curve, as it were, and so we did not see the surges that we saw in other countries, which has allowed our drug supply the time needed to ramp up production or to import other medications to meet that ongoing demand.
The pandemic, definitely shook everyone. I think when you think about pharmacy, the line that I give people, I say, it's probably one of the areas or industries where it's a little bit pandemic proof, where people will always need their medication. But that being said, obviously, it still did have an impact on how we practice pharmacy. Implementing the social distancing and the PPE measures was definitely a big change for us. Limiting the number of people in the pharmacy, limiting like our operating hours, unfortunately cutting back on staff because we did see a little bit of a decrease in prescription volume. But overall, people still needed their medications, and we just had to find ways to make sure that we were able to fulfill their medications in a safe and effective way, and also counsel patients from a distance, whether it be physically distancing or even like virtual counseling. So we've implemented some strategies there. So really, we were able to still meet the needs of our patients in the face of the pandemic. It did require a little bit of investment, some adjustment from our staff, but I think we did a pretty good job. And patients at the end of the day are the most important thing, and their health. And I think we're pretty happy with the position that we're in with respect to maintaining a high level of patient care.
I think some of you may be aware that at the very beginning, after China, Italy was a big culprit to start spreading the infection. It wasn't only an Italian problem, but we obviously faced the COVID, let's say, as a front line, because after China, from China, nothing's was coming out, or just few. I remember those in the very beginning, those days, the day before, it was quite on the mainstream. I mean, it was all quiet. The day after, suddenly the newspapers start talking about a lot of positive people to the COVID test. And these numbers keep increasing and spiking in a few days, and panic grow very quickly. We are an elderly country, so as you may know, elders are hit most by COVID. So fear spread out very quickly. We had the first lockdown at the beginning of March. And it was the very first in all over the world, except the exception made for China. And pharmacies were one of the very few, let's say, jobs left open. Even if at the beginning it was let's call it a half lockdown. They didn't stop all the activities in Italy, but even in April, when the lockdown went really real, pharmacies, hospitals, obviously, even if they were, it was forbidden to go there, were the very few activities left open. So we had a very, I can say, a very important role in giving care and the continuities to medications to people.
I'm in the unique position that the first case of COVID in Washington, or in the United States, actually was in the hospital that I was born in, which is in the county where one of my stores is. And then the first outbreak that happened in the nursing homes is in the hospital that my children were born in. So, and in the county where my second store is. So, you know, we've been going at this since February here. We saw, of course, a huge spike initially, although most of those, if you really look at it, were with the nursing home outbreaks and such. Washington State currently is seeing an uptick, as the majority of the states are right now, although I don't think we're anywhere close to capacity with ICU or any of that. I do think that we're finding that most of the cases are less severe, you know, and I think they're figuring out some better ways to deal with it early on, as opposed to waiting until they have to be, you know, tubed. So we personally here at the store have dealt with a couple of cases in families of employees. None of my employees have come down with anything at this point, so we've been pretty lucky here.
So in the United States, currently right now, since we're in July of 2020, we're seeing in California an uptick in the number of cases. We had a stay-at-home order and closure of many non-essential businesses, most non-essential businesses, since March of 2020. And then as we had thought that we had a hold on a good hold on the pandemic and the number of cases spreading, California entered into the reopening phase of the state, and we started to reopen certain businesses and allow for outdoor activities. And what we're seeing now is an increase in the number of cases. So in terms of locally in San Diego, at my institution at UC San Diego Health, we're seeing more cases than we had ever seen since the pandemic first started.
So it was obviously quite badly affected, probably one of the worst in Europe at least. So it generally hit the London areas around about March, spread mostly to the northwest and to the Midlands, which is essentially the middle of the country. It didn't get so far as to where we work really in the southwest. We think potentially the lockdown implementation meant that the southwest was not badly hit at all. So in terms of my practice, where I work, there was an awful lot of preparation for what we thought was to come, and it never really did. We didn't get the overwhelming number of cases that we thought we were going to get and all that sort of thing. So in a hospital setting, what my role was as a surgical pharmacist was helping support our theatre environments to be equipped to be intensive care areas should that be needed, because our anticipation was that our intensive care bed base for adults would probably quadruple from about 50 beds to somewhere nearer 200 to 250 beds. So we were looking at sort of sourcing, obviously, the equipment that was needed, but from my point of view, working out how we can deliver medication to that safely, and also upskilling some of our more junior pharmacists to be able to clinically review critical care level patients, so that, because we were going from a handful of pharmacists to a critically care trained, of which I was one of them, to potentially needing 2 or 3 times that amount. The other role that we had in a hospital setting is that we set up a number of local intensive care units from sort of retrofitted areas. So things like some music arenas and university buildings were set up as ventilatory units that some of which were needed, some weren't in the end. So again, we were trying to provide a pharmacy service to those, which was largely involving providing pharmacists to provide clinical support, but also practical support, because like in our profession, there would have been lots of nurses that were being quickly upskilled to manage critical care patients and all that sort of thing. I'm obviously less cited on a community setting, but I think the biggest pressures there probably were more in the earlier stages when a lot of people were panicking about lockdown and medicine shortages and all that sort of thing. And I think their workload was just overwhelmed because, of course, everybody was expecting their medication. They wanted to stockpile a lot of things because of the suspicion that all will go out of stock. And I don't think GPs and pharmacies were trying to deter that, because we recognized that people wanted to stay home and that was the advice that they should have. So probably around that March time, everybody was trying to get stockpiles in, and the problem with that workforce then was more the level of work that was coming through the door and just keeping up with it, and that whole sort of supply and demand issue.
Ecuador, ustedes conocen, tiene muy poco presupuesto y eso es uno de los factores que más nos ha golpeado durante la pandemia. La pandemia empezó en una gran zona del Ecuador, en una gran ciudad, que es la segunda ciudad más poblada, que fue Guayaquil, la cual nos golpeó justo cuando estábamos recién tratando de aprender sobre este nuevo virus del SARS-CoV-2, sobre esta nueva enfermedad del COVID-19. En realidad fueron muchísimos muertos, más de lo que se reporta por parte del Estado. Se piensa que son cerca de 20 a 30.000 por el exceso de muertos que hay, comparando con años anteriores, y aún seguimos golpeados por esta pandemia. En realidad no llegamos aún a un pico. Toda curva pandémica tiene una meseta, que es la primera curva o la primera ola de contagios. Al momento no hemos llegado a la misma. Estamos teniendo muchos brotes actualmente en varias ciudades. Pensábamos que lo peor había sido este primer brote en la ciudad que les comento, Guayaquil, pero estamos teniendo muchos brotes actualmente en varias ciudades del país y estamos en alerta, pues no queremos que una segunda ola nos ataque tan pronto, aunque la Organización Mundial de la Salud es muy clara y nos dice que en Latinoamérica los países pueden ser muy rápidamente golpeados por una segunda ola. Estamos tratando de frenar esto. Bueno, del espacio público y cómo hemos ayudado a los farmacéuticos en esta primera línea, pues en general el trabajo de todo trabajador de salud ha aportado en Ecuador. Las primeras líneas de farmacia, pues no hubo una disposición o no hubo un buen acceso a fármacos, pero las farmacias trataron de mantenerse siempre en stock. Llegamos a un momento que los fármacos eran muy escasos, pero con el trabajo de los farmacéuticos, el trabajo de las empresas comercializadoras farmacéuticas, nos pudimos abastecer para poder solventar esta demanda y superar esta primera ola que les comenté fue en la ciudad de Guayaquil. Ahora estamos abasteciéndonos para poder enfrentar estos nuevos brotes.
So as at today, 23rd June 2020, its total samples tested 115,760. Then the confirmed cases so far as at today, 20,919. Then the active cases from those confirmed cases, some of them have been discharged. So the active cases that are being taken care of now, 13,285. Then discharged, total people that have been discharged, 7,109. Then the total deaths that have been recorded, 525. That is the current state of the COVID-19 in Nigeria. And then the government has actually put in place several protective measures. When the issue really started, we had to have some forms of lockdown. Some were partial, some were total lockdowns. Marketplaces were locked down. Religious centers were locked down, because these are places where we know that rate of transmission can actually get spiked. Rate of transmission can increase in these places. So there were lockdowns put in place in those places so as to reduce the rate at which people have contact, because there is no way respiratory droplets will not be transmitted in places like this. So schools, marketplaces, religious centers on lockdown just to reduce the rate of transmission. And then after some days and some weeks, we noticed that there's this certain population of Nigerians that depend on what they earn daily to feed and have a life. So the lockdown actually affected so many people like that. So when we actually looked into things like this, the government had to create and set up measures to see how people like this can be helped. So some forms of relief materials were distributed to people like that, vulnerable people like that. And then at some point, the lockdown, they started easing the lockdown just to ensure that the what's it called now, activities can go back to normal gradually. Do you understand? Because Nigeria, trust me, we have a lot of people in Nigeria, about 200 million people, and then making 200 million people sit at home, it's going to affect a lot of things, the economy. You can't travel, you can't move around, so it's actually going to affect a lot. So we have to look at all those things and then see how we can ease the lockdown a bit while still making sure people are adhering to the protective measures to prevent the spread of the virus. For some pharmacies in Nigeria, some of them run 24-hour service.
Okay.
Some, not all. Yes, not all. Most pharmacies run from morning to evening, let's say about 8 p.m., 9 p.m. before they shut down for the day. But during the pandemic, actually during the lockdown period, when there was a total lockdown, people were not coming out, but pharmacies were still open actually because people still needed to access their drugs and medications. It's not just COVID-19 we're battling, there are other disease conditions we are also taking care of. Do you understand? So the pharmacies were still open at those points, and then proper measures were taken to prevent the pharmacists and the people working in the pharmacies from getting infected too. So the use of PPEs, the face masks, the social distancing, hand washing techniques, use of sanitizers, all these measures were put in place to prevent or protect pharmacy workers from getting infected, because we can't afford to get all our health workers infected. Who's going to take care of the population? So all these protective measures have been put in place. So these are new things that have been incorporated into the pharmacy practice to reduce the spread.
Okay, I think from the news as of today, you probably know that Singapore has crossed 50,000 cases as of today. But looking at the numbers, we are probably have one of the lowest ICU cases in the world. So we don't have that many ICU cases for the COVID-19. And the fatality rate is actually pretty low. It's probably about 0.1% or so, given that we have over 50,000. So that is probably because we also have a facility set up to, house all these COVID positive patients who are probably well. And then the medical team actually could identify them early, to triage them to a different, either the high dependency wards or the ICU isolation. Yeah. So we are pretty much quite ready for that here in Singapore.